When I was in college, my mother actually got diagnosed with pancreatic cancer. And so I got to see firsthand how scary it was as a family member and how helpful it can be to have a doctor or a nurse practitioner or anybody on the team to kind of help hold our hands throughout the difficult process. So that really inspired me into going to medicine and into oncology. I am a hematologist and oncologist, and so I see patients with cancer, benign and malignant blood disorders. A lot of our cancer patients already have a diagnosis, but more and more we're starting to see patients earlier on in their journey, and so sometimes they may be coming to us with a suspicious mass that they saw on CT scan from as far as cancer is concerned, and we help with the workup. As far as blood disorders are concerned, usually no diagnosis before they come to see us. I would usually take some time to introduce myself and to make sure that I know what the patient understands about his or her own illness and how I can best help the patient. And after that, we would go over the patient's concerns, and I would go over the hard data in terms of blood work and imaging findings, and ultimately arrive at a diagnosis or a treatment plan so that we can get to a diagnosis. We would then talk about whether the patient is a candidate for surgery or radiation treatment or chemotherapy or targeted therapy, which is what I do. There are an increasing number of treatment options now for cancer patients, and a lot of times if we can avoid chemotherapy and give them something along the lines of targeted therapy or immunotherapy, which is another treatment that targets the patient's immune system, we would do that instead of going through the more toxic treatments. It's a true privilege to be able to accompany the patient and his or her family members throughout that very emotional and difficult journey.